UNFPA has been supporting countries in preparing their country reports into the Lima meeting that Deanne referenced. So what I will come with is kind of a summary of the critical issues that came up through those individual reports, which we kind of amalgamated. So interesting, from the top-down view, levels of adolescent pregnancy are dropping. From the country level up, first critical issue that every country that prepared a report mentioned is the concern about the high levels of adolescent pregnancy. The way it correlates with income, and so it perpetuates both income and gender inequality, and leads to the intergenerational transmission of poverty. And then, as I point out to ministers when they're giving me side eye on why they should care about this, if you calculate this out along the long arc, at some point you will care, because you're growing, you're poor, and the chances of you having a robust social protection system are diminishing. And in fact, Jamaica has been looking at this. They're getting very concerned as they run the figures. I think Andrea may speak to some of that. Early sexual debut in the region, I frankly find the figures horrifying, particularly the report on the high rate of forced early sexual debut. And keeping in mind that people who lie about sex, the only thing they lie about more is their taxes. The figures that we're seeing, I would guess, are probably a good 30% off, and it's reported as 32% of men and 48% of women say that their first experience was non-consensual. And that is really appalling. Comprehensive sexuality education, the region has had a strategy, the HFLE, Health and Family Life Education Program, for 24 years. Ask anybody who deals with this what the implementation has been. Staunch resistance on all fronts to implement this. Legislative barriers that prevent adolescents access to sexual and reproductive health services, and this in a region where frequently across the region, the age of consent or the age at which you can marry is 16, but you can't access contraception until you're 18. I mean, I would love to live in the mind of a legislator. And to note that one point of major intersection with the Latin American dynamic, where we're usually not in such intersection, is this region taken at large, Latin American Caribbean, has the highest percentage of governments restricting access to contraceptive services. The region continues, and this is 20 plus years on, to have the highest HIV prevalence in the world, second only to sub-Saharan Africa. I should mention we also are second in the world on adolescent pregnancy. We'd love to be leaders, and would that we would lead in a more progressive and optimistic spirit. The highest levels of infection are in Bahamas, Jamaica, and Trinidad and Tobago. And then here's another horrifying statistic. Young people account for 1/3 of new infections.